All right, everybody. Thank you for the opportunity to speak with you today. I'm excited about being able to share some of the actionable items that my team has done with at UC San Diego Health System. I think one of the things, just some background information about our medical centers. We have 2 medical centers. They're both academic. We have a room service program at each location, a little varied process. Our last year, we served more than 700,000 patient meals, and we had more than almost 1.2 million retail transactions. So I don't know how big that is. I know it's not big compared to Dan. Dan's numbers are probably 2 or 3 times what we do. But I just want to share with that. So I think what's been nice about what we've been able to do is we've been able to do some things in San Diego that I've not heard being done in other locations. So the NHL Team is the Nutrition and Healthcare Leadership Team. It's a collaborative group of food service operators from medical centers, skilled nursing facilities, the school districts, and then we collaborate with a local nonprofit group that's focusing on improving the accessibility to healthy foods to the community of San Diego. So in this photo right here, the young gentleman on the left, Danny, is one of our produce vendors, and he's a partner of ours that we've worked with for at least 6 years since I've been there, and I worked with him with his organization when I was at Kaiser as well. And then the young lady on the right is Alicia Bell. She's the executive chef at Palomar, which is one of the hospitals that participates in the meeting with us. So right there, that's a photo from our annual Good Food Showcase. So what the Good Food Showcase is, it provides an opportunity to bring vendors, the farmers themselves, the produce vendors, the buyers from the group. So it's the universities, it's the medical centers, it's some of the school districts. And it's kind of like just a food showcase. So we go there, we meet people. What's great about it is in California, we have some regulatory issues that makes it a little bit challenging to buy directly from a farmer. In this situation, what we do is I go there, I meet the bean farmer and say, oh, I like this guy, I want to work with him. Then I go grab Danny and say, Danny, I want you to come talk to the bean farmer, and I want you to work out a deal. So then what I'm doing is giving him an opportunity to become, to sell his wares to us, and then possibly to sell to other people. Over the last 3 or 4 years, probably each year, 2 to 3 different vendors build new relationships with different buyers, and it's been really successful. Also, the other thing with the Nutrition and Healthcare Leadership Team that we've done, it's really fun, is for the last 3 years, we have what's San Diego Magazine has a top doctor award. And so 3 years ago, we decided to collaborate with them. And so what we do is a top chef competition, and it's only healthcare people. So the rules are really simple. It has to be heart healthy compliant, and it has to be a menu item that is being served on your patient menu. I'm not going to say there's no competitiveness. I might want to beat certain organizations more than others, but it's a really fun time. Our chef has won. Sometimes everybody's had a great time winning with it. Last year's judges were celebrity chef Brian Malarkey was there, and then the San Diego Magazine critic Troy Johnson was one of the people as well. The best part about that whole event is we're showcasing to the physicians, because these are the top doctors in San Diego, but we're showcasing to them the foods that we're serving that we're very proud of. We're very proud and happy that we feel like we serve delicious, healthy, and sustainable foods to our patients. One of the things that I like to say is that I think food service has changed. We're no longer healthcare food services. We are restaurant style or restaurant quality foods in a hospital setting. That's it. We have an executive chef. What he does for us is tremendous. I couldn't be happier with him. He's in the room today, so I don't want to say too much about Rodney Fry, but he's a great guy. Especially because I know he hates me saying his name in front of people. So, but yeah, so that's a great thing. And what comes out of this group, we meet probably every couple months and we get together and we've learned how to partner with each other. These are my competitors. It's Kaiser, it's Scripps, it's Sharp. But I'm not concerned about competing with them. I'm more about the collaboration with them and how can we help each other make our jobs a little bit easier. Just last week, we were looking at buying a plant-based burger for our facility. Talked to the rep. He gave us what he thought he could offer us. He wants more volume. So I reached out to my peer at Kaiser. Then I reached out to my peer at Scripps and said, hey, this is the item we're looking at. Are you guys interested? They're both interested. So we kind of have our own, I'm not trying to take business away from any GPOs, But we kind of are doing some of that work ourselves and saying, hey, why wouldn't we just try to help each other? We do it with produce. And what's been successful with that is it allowed us to increase the purchasing of antibiotic-free meats, the purchasing of the local produce, to add new items. And we also discuss operational changes there as well. But it's a really great group. I think we're special in San Diego that we had that opportunity to do that, and I look forward to working with them further. So one of the projects that came out of this was our organic waste diversion. We started this about 3 years ago. A vendor will drop off the bins that are on the left, I don't know, the ones that aren't open. Those bins come to us, they're clean, they're sanitized, they bring them to us, we bring them into our kitchen. We then discard all of our post-patient food that comes back down to us, and then we also discard our pre-production waste. So one of the things we were looking at was, it's great, we did this, we're excited about it, we're diverting it from the landfill, and what we're doing, we divert it from the landfill, is it helps prevent methane gas production. It's also a cost savings for the organization, because that was all going into our trash removal, and so EVS was having to pay for it. So that's an indirect savings cost for them. So some of the data that we got from that is, in 2018, we had 121 tons of diverted organic waste. Good, but we felt happy about that. 2019, our head number came back at 171 tons. So I immediately start to freak out, thinking I'm done something wrong. How come it's going up? It should be going down. There's some challenges with the data that we're trying to coordinate with them and fix. But you got to look at it this way. It's successful. The success is we're diverting waste that would be going into a landfill, and it's being turned into soil enhancement. The other thing is that I'm saving money for the organization. The opportunity comes from that is we can do better. So what we looked at when we started realizing why were our numbers going up is we were trying to figure out it can't just be pre-production waste. Then we figured out a lot of the waste that we were having was still edible food. It was edible food that we were throwing away because it expired in our world, but it was someplace else that we could take it to. So we coordinated with one of our NHL Team members who worked with the company, and they made us aware of a food donation. So we applied for a grant early 2018, and we were accepted for the grant to have Lean Path installed at both of our medical centers. So we installed Lean Path in early 19, and in the last 5 months, we have donated more than 7,200 pounds of food to a couple organizations in the San Diego area. One is for college students who are food insecure, and then the other one is for a homeless shelter in San Diego. So we're really excited about that. This picture on the left is the weighing unit, and then the young people in the picture are the college students who coordinate the food program pantry at the university, and they come and pick up the food from us. So we're excited about that. It's something we're moving forward with. We'll see what we do with it next year. And again, the food donations is after we try to repurpose food as much as possible. So repurpose, then we donate. So I'm not sure how many people are familiar with the Cool Food Pledge. The Cool Food Pledge is a collaborative effort by participants to have a goal of decreasing greenhouse gas emissions by the foods we purchase by 25% by 2030 based off of your data. They wanted the baseline to be in 2015. It's sponsored and coordinated by the World Resource Institute, Practice Green Health, and Healthcare Without Harm. So one of the things we looked at is we were very fortunate. We also we work with a vendor who we make them do the data collection for us. I don't know about anybody else, but whenever we have to do data collection for an annual report, it takes a lot of work. This organization really helps us because what we do is we get all of our invoices to them. They've identified, or we help identify the foods that meet the criteria we're looking for, and then they do that. So we've tracked the last 3 years of total food purchases. This is our 2017 data that we're using for our baseline. And so the bar graph on the left shows that in 2017, we purchased a little over 500,000 kilograms of weighted food, total weight. Of that, 7% of it was beef. So I feel pretty good. We're not buying a lot of beef. I'm not against it, but I don't feel like we're buying a lot of beef. The thing that you have to look at, though, that 7% of the beef is responsible or associated with 45% of the greenhouse gas emissions of the food we purchase. Compare that to the dairy. The dairy's 30% of weight, but it only accounts for 25% of the greenhouse gas. So what we decided was, obviously the thing we need to address to improve and do our part of this group is that we need to find a way to decrease our utilization of beef in our program. So here's some of the things that our executive chef has come up with. The Dean Ornish program, it's a lifestyle program that we utilize in our cardiac rehab facility within our hospital. It's a plant-based, whole food, low-fat diet plan that has been shown to reverse heart disease. So we've been doing that. So one of the things we decided was we're going to put one of the Dean Ornish meals in our cafeterias Monday through Friday, 5 days a week. Well, that's obviously 5 days a week. And then some of the other things that we decided to do was the chef came up with, we decreased our beef menu center of the plate items in our 4-week cycle from 15% down to 4%. And then the other thing that he did that I think is really tremendous is that he took, prior to the menu conversion that he's working on, we had 1 to 2 vegan options in a 4-week cycle, and now we're up to over 52 of them. So I think he's done a great job of that. We're trying to find ways to do that, and our customers are asking for it, so we're really doing a good effort on it. So how do you do this? I can tell you when I got hired at my position in 2013, I was very, I was new. I'd only been an assistant director. I was having to work with my peers at San Francisco and UCLA and Davis, and was kind of questioning how I had gotten hired. I knew Dan by name and was like, oh my God, I'm working with Dan Henroy. That's awesome. Scared me the bejeebers for a while, but then turned out he's a good guy. So the whole concept to me, I was overwhelmed when I took my job. I will honestly admit when they said, what are your sustainability numbers? I thought as long as we weren't using styrofoam, we were doing pretty good. That's what I thought sustainability was. We've learned a lot about it since then, and we've really continued to grow and to develop those programs and some of the action items that we've been able to do. So what I would suggest to everybody who's doing this is you have to look at it a couple different things. One, taking a small bite, like Dan talked about, we were talking about the whole idea is you want to make sure that you do small, achievable little processes. I look back on our time and realize, gosh, we've done a lot. It seems like they were simple, small steps, but over the time we've done really well. We've gotten closer to my peers at with San Francisco and UCLA in our sustainability efforts. But I think the big thing is you have to be able to share what you're doing and make those efforts to be possible for everybody else to achieve some success. And I always tell people I'm super lazy. I will give away information because I'm hoping in return somebody else is going to give me information that I don't have to do a lot of work. And so I'm really open to sharing what we've done and the successes we've had at UC San Diego Health, and hope that everybody else can find their journey with sustainability. Thank you.